The Scottish Human Rights Commission was established in 2008 and promotes and protects the human rights of everyone living in Scotland. Over the past 3 years, the Commission has reviewed a wide range of research on the realisation of human rights in Scotland. The gaps and good practices identified in the research will be addressed by developing Scotland's National Action Plan for Human Rights.
Human rights are the basic rights and freedoms to which all of us are entitled. They allow us to live our lives with dignity and are required to be recognised for each of us. Over the past 3 years, the Commission has been considering human rights in Scotland. That has allowed us to identify gaps and to identify good practice. The research has brought out some interesting questions for us. It does indicate that human rights are not in a vacuum, that they impact on people each and every day, and that decisions are taken affecting people's human rights, whether it be in courts, in classrooms, in care homes, right throughout their everyday lives in Scotland. This research is important to identify shortfalls in the attaining human rights for people in Scotland, to ensure that those human rights, which may well be there in statute, are actually there in reality for people. And it's closing that gap that we've spent so much of this time researching.
And in scoping the gaps in good practices in human rights protection, we looked at human rights across 8 themes of life in Scotland. And they were dignity and care, health, where we live, education and work, private and family life, safety and security, living in detention, and access to justice and the right to an effective remedy. To give an idea of the types of issues that are covered within the report, on the topic of where we live, the evidence suggests that the right to adequate housing, the rights of those living in rural areas, and the lived experience of where Scottish Gypsy travellers live were major areas of concern for individuals and their communities, third sector organisations, as well as the agencies that deliver services. Affordability, disparity in access to services, fuel poverty and discrimination can all be seen through a lens of human rights, and it's easy to see actually how human rights impacts on every area of our lives. As we undertook this project, we also spoke to a range of people across Scotland about their experiences of human rights, some of them in very difficult situations, and here's what they said.
Are you going to be treated worse because that you've said you're a gypsy traveller? Are you going to be treated better or worse? You've got this attitude because you have been harassed all your life, collar and ties. Services with authority. I've never trusted and I still don't trust.
I asked, I don't know how many times, for social work to help and intervene with my son. You could see he was having problems dealing with the aftermath of what had happened, but no, the request had come from school or another agency. It couldn't come from me. There I was saying, please help us, we need help now. Scotland's National Action Plan for Human Rights could help to end the inconsistencies and provide a more systematic approach. By developing a national action plan with involvement from those who deliver public services as well as those whose human rights should be protected, the Commission hopes to show the potential to deliver real and sustainable improvements for everyone, especially the most marginalised people in Scotland.
I think that in terms of Scotland's laws and institutions, by and large, Scotland can be quite pleased with the progress it has made. Equally, in some areas of policy and strategy, again, there are positive developments that have taken place. But where Scotland can't be complacent is that these laws and policies aren't actually being implemented and impacting on people's living experience in the way that we think they are and should be. That's where the inconsistency is taking place, and that's where Scotland can progress a lot more and do that a lot better. So the point of coming to the conclusion that we need to assure and not assume that rights are actually being realised in everyday life, decisions about healthcare, social care, access to justice, housing, in order to assure that these rights are recognised and fulfilled in everyday experience, Scotland needs a national action plan for human rights. This action plan will be shaped in a very inclusive, participatory way, based on facts, on evidence, and coming to an agreement as to what are the priorities, what needs to be done, by who, how, over what kind of realistic timeline, and in the economic constraints that we all have to recognise today and indeed over the next few years. The United Nations has recommended to all countries that they develop national action plans. Where this has been done successfully in other countries, such as New Zealand, Australia, Sweden, Finland, it has been found there are real positive outcomes for people in their everyday life.
To make Scotland's National Action Plan effective, we need your help. Those whose rights are affected, those with responsibilities. As part of our consultation, we have two key questions. What do you think are the key gaps in the realisation of human rights in Scotland? What do you think would be the most effective and achievable way of addressing these gaps? We appreciate everyone's input, and you can get involved between now and the end of March 2013.